Before the pandemic, we had gingerly been testing the waters with virtual doctor visits. Now they are becoming the present and the future. The benefits are obvious, but not to everyone. But not everyone has access to their physicians in a virtual setting. Joining us now is Jason Gorevic, the CEO of Teladoc Health, which we've discussed several times already this morning, a company that provides virtual care solutions globally. Jason, thank you so much for joining us. I just asked Secretary Azar if he's going to, keep, the money flowing for people that are using your services, and he said, I think he said, a little cryptic, that it sounds good. But tell us what you have seen. We've been talking a little bit about how the real shift of everyone into the digital world has finally happened. But tell us from your dashboard what it looks like.
Well, hi, Steve. Thanks for having me on. I was emboldened and pleased to hear the Secretary's words. I think he said telemedicine is now an embedded part of the healthcare system, and I couldn't agree more. We knew for a long time, I've been doing this 11 years now, we've known for a long time that the world would finally wake up one day to the benefits and merits of telemedicine and the role that virtual care can play in the healthcare system. We didn't really think it would take a pandemic and that all of the world would understand it one day at the same time. So it created a bit of a wave of demand. But we've seen just a massive acceleration both in consumer adoption and provider adoption. We're pleased to see both federal and state governments take steps to encourage that use, and the role of virtual care, I think, has changed forever.
How do you deal with the debate right now where there's a crowd out there that believes that you're supplanting, human visits, doctor to patient? I would argue with them and say, you know what, the level of misdiagnosis in that world was extremely high. But I'm just interested in how you deal with those who resist what you're trying to do as dehumanizing, as not kind of giving that full comfort that many people felt they were experiencing in person-to-person doctor visits.
I think I would point to our consumer feedback as the biggest proof point that consumers don't find this dehumanizing at all. In fact, they find it more convenient, care on their terms, when they need it, in the form that they're used to getting other forms of services and products. And as a result, we have net promoter scores in the mid-60s that are more like Apple than the traditional healthcare system. And I think the other thing that we've seen now is those people who were detractors even 6 months ago have embraced telemedicine, maybe beginning out of necessity, but then because they find it a more effective way to deliver care. Now, certainly not everything is appropriate. We can't suture lacerations or set broken bones remotely. But what we're finding is everything from basic services all the way to oncology and neonatal care can be done remotely in a very effective way.
How much of the, I hate to put it this way, the COVID picture, those people that are suffering, that are symptomatic, that may have this, is there any of that you can help guide Americans who feel they may be sick through?
Oh, certainly. Even during our spike times in the middle of March, we were seeing 10% plus of our visitors have COVID symptoms. We were able to get them to the right care locations or keep them at home in the event that they were mildly symptomatic and didn't have high risk factors in order to control infection. And I think that's one of the most critical parts here is during the pandemic, keeping people away from others and infecting others is a critical component of controlling the surge and the spread. And I think you heard Dr. Rue earlier from Geisinger talk about trying to keep people in their homes. Now, that's beneficial all the time, trying to keep them out of the hospital, but it becomes that much more beneficial during a pandemic.
Now, in your world, and again, this is a very naive question perhaps, but when you kind of follow healthcare reform, whether with Obamacare or alternatives to it, a lot of it has been to kind of move Americans away from fee-for-service to a wellness frame, if you will, that they're, particularly to deal with some of the chronic conditions that are sort of endemic in the United States and begin moving that towards kind of a total health picture. Is that something that's comfortable for the telehealth area, or are you sort of part of that transactional fee-for-service piece of this?
No, I mean, we're definitely a part of the value-based reimbursement or value-based care equation. It's a fundamentally lower cost, more efficient delivery mechanism because it doesn't have all the capital infrastructure and cost that's required with big brick and mortar. But even more to the point, using digital tools and virtual care can increase the frequency and velocity of interactions between a consumer and the healthcare industry, and therefore make the data richer to be able to deliver just better care. Better care that enables us to reimagine how care is delivered and the relationship between a consumer and the healthcare system. And that's never more true than for the chronically ill.
In the health ecosystem space, Jason, I hate to put it this way, but I'm kind of blunt. Are hospitals friends or foes? Are you allied with everyone, or is there anyone that's kind of totally opposed to you succeeding?
I think Teladoc Health is uniquely positioned in that we deliver care to consumers who are in need of a healthcare provider and care now. But we also enable providers, especially large hospitals and health systems, to deliver virtual care using our technology platform that is purpose-built for the healthcare system and for those providers delivering care within the confines of their workflow and their clinical use cases. And we just closed the acquisition of InTouch Health, which is another step in the efforts to facilitate the delivery of care for hospitals and health systems and other providers.
And what is it like around the nation? Is it a patchwork of regulations you have to work through, or is there a kind of one-stop shop that you can go and kind of negotiate all the regulations with? So are you gotta go to every state capital, or is DC enough? What does the regulatory environment out there for your folks look like?
Like with most things in healthcare, it's a mixed bag. Certainly, state regulations govern the delivery of healthcare, the licensure of healthcare, and we saw that at the beginning of the pandemic when we had hotspots, and some of the state regulations and licensure requirements were barriers to being able to mobilize care across state lines to where it was needed most. Now, a number of the states moved in order to relax those requirements. But I think it would be helpful if in a national emergency, we had a mechanism to do that ubiquitously across the country. Other things are at the federal level. And, you heard the secretary talk about reimbursement and not going backwards. I think that's a great thing to say. And we really need an act of Congress in order to remove the originating site and the rural geography requirements in order for HHS and CMS particularly to facilitate the reimbursement for Medicare. And then lastly, I think the federal government and the department especially acted appropriately to suspend the enforcement of HIPAA during this national emergency. I do think it's important that we get back to enforcing HIPAA as we come out the other end of this, because privacy and data security are paramount when it comes to healthcare.
We got a few more minutes here, so I want to go deeper. I want to, when you kind of look at the broad health cost scene, and I know you're attacking that in a way because you're providing, a less expensive option, but you've also worked in the past with health insurers, and I think one of my hopes today is to have, those that are providers and those are insurers, those that are innovators. The Biosimilars Forum is, supporting this today. You've got, we try to get everybody in the sandbox. So I want you to take off your hat of self-interest for a moment and tell us, for us people that are just, clients of the system, what's driving up costs and how do we get it under control? Is it the insurance companies because people feel that, deductible hitting them? Is it the I'm going to have the head of pharma, Stephen Ubel, on shortly. Is it his fault? What's going on in terms of the health ecosystem, in terms of really attacking this, or is everyone to blame?
Wow, you're going to ask me to throw stones, huh, Steve? I'm a recovering health plan executive, so I have a viewpoint of the CEO of Teladoc Health, but also a former health plan president. I don't think there's a single thing to blame here. I think we have had misalignment of incentives. I think value-based care does move in the right direction, but I think we haven't really tackled that in a way that truly embraces the sharing of risk and the sharing of rewards across the system. I think there's still too much reimbursement that favors fee for service and more services. Certainly, interconnectivity and data sharing is an issue where people get more tests than they need. They get repeat tests because the data is not available to all the providers. And we are seeing a massive increase in cost on the pharma side, specifically for high-cost biologics, specialty pharma, which makes a real impact on people's lives, but has a massive cost. And so a lot of the large employers I talk to say that that's the highest trend part of their healthcare dollars.
I think that was a great answer that you will, not be killed for. So let me take we've been taking questions from today, and I've got a question for you from Betsy. Betsy?
Hello, I'm Dr. Betsy Sigmund from Raleigh, North Carolina. How do you see wearable sensors with tangible, verifiable metrics being incorporated into telemedicine, reimbursement approval from CMS, and doctors' ability to store, interpret, and be compensated for their time?
Jason?
Well, thanks for that, Betsy. I think that's a great question. I think wearables are a significant opportunity for us. I tell the story sometimes. I'm a mild hypertensive. I go about every 18 months to see my cardiologist. And this last time he asked me about my exercise patterns. And I told him, and I think he wanted to verify it. So he asked me for my iPhone, and he checked on how many steps I'm taking and how many flights of stairs I'm taking and climbing on the days that I'm not actively exercising. And I think there's real opportunity for that data to be available on a single platform or on an interoperable platform to facilitate better delivery of care, especially in a telemedicine environment. And I do believe that we're going to move in the right direction with respect to reimbursement for all of the care that's delivered around that.
Well, Betsy, thanks for your question. Jason, thank you so much for joining us and telling us about Teladoc Health. I look forward to having you back to talk about shared risks and rewards and all of that. We could go on for at least an hour, I think. So thank you very much for joining us today.
Thanks, Steve.